Good morning and good afternoon, fellow Hatzen. Today being the HIV and AIDS Day, I know most of people will be sharing different messages and celebrating, and we will be remembering those our loved ones who died out of this disease. And as we do that, let us keep in mind that we are still having another enemy, which is COVID-19. And I would like to read one paragraph in one of the books here, which was written by Brookesmith, Peter Brookesmith. And for those of you who have read this book, in chapter 3 of this book, the author was talking about the invisible plan. And this, he was talking about, he had written something about HIV/AIDS. And as you can see from the picture, these people were on the street striking because somebody said that there's HIV/AIDS. They didn't take it serious. And that is why I'm going to read this part. And let us relate this part with what is happening now with the COVID-19. So I will read. The author says, AIDS is the most political of all diseases. AIDS is the most political of all diseases. Up to that part. Can you relate it to the COVID-19? Then he continues saying by, when first it struck, research and education about it were blocked for political reasons. Isn't that what we are experiencing in different countries around the world? You know best. If it radiates through the developing world in the way current projections suggest, political and economic life everywhere will be affected. Underline the word everywhere. It's saying that if it radiates through the developing world in the way current projection suggests, political and economic life everywhere will be affected. Isn't that what is happening now? Although there is now hope of an effective treatment for the disease, are we having hope of getting vaccine for COVID-19? Is it that the story going on around the world? Every person is trying to get the vaccine? Then he says this, although there is now hope of an effective treatment for the disease, it will be extraordinarily expensive. It will be extraordinarily expensive. And the benefit will be left in rich countries rather than poor ones. Are you from the rich country? Are you from the poor country? And if you're from the poor country, are you flouting the rules that are given by the health ministries towards the COVID-19? Are you wearing masks? Are you keeping distance? Are you sanitizing? The vaccine may come for COVID-19, but the same statement which I've just read here will be the results if you can't obey the rules and the laws towards preventing the spread of COVID-19. Only by looking such disturbing facts in the face, we can decide on a rational response to the crisis. So let's see. With the COVID-19, when it started, people were not paying much attention about the disease. There were a lot of politics, a lot of doubts, a lot of finger pointings, a lot of complaints, and people were not paying attention for the precautions. And that is how HIV/AIDS also, when it started, people were not paying attention. People were being asked, use condom, abstain from having intimate with everyone. Then people were not taking care. The same thing. We are being asked to wear a mask whenever we are in the public. We are being asked to keep distance. We are being asked to sanitize. But the human being will always wait and see with his own eyes, especially when the disease strike inside your house is when you will be like, oh, this thing is real. It's the same as death. While people are still crying at your neighbor's house, my friends, human being won't take the death serious. But the moment the death got into your house is when you will be like, oh my God, there's death in this world. The same as hunger. When your neighbor is sleeping without food, you won't even care. You'll be like, is there hunger in this world? Are there people who can still sleep without food? But when it came inside your house, by the time you start sleeping without food, it's when you will know there is poverty. So my fellow Earthzen, please let us obey what we are being told. Be it a matter of health, be it a matter of security. Let us always obey, try to obey the rules. Please, and for this COVID-19, as we celebrate AIDS Day, let us remember that AIDS did not just start like that, did not just spread like that. It was spread by human being after failing to obey the rules and the laws and the regulations that were put in place in order to prevent the spread. So please, fellow Earthzen, try your level best. Let us help our doctors, let us help our government by doing whatever we can to prevent the spread of COVID-19. A lot of people have died, it's unfortunate, but let us not give room again for something that we can help ourselves. If it's mask that will help us, please wear the mask. If it is hand washing every time, please wash your hands. If it is sanitizing, please sanitize. If it is keeping distance, social distance, please keep social distance. That does not mean if you keep social distance, you are keeping your friends away from you forever. No. It is helping the current generation, the future generation. Thank you and happy HIV/AIDS Day. Stay safe.